Hi everyone, how are you doing today?
Hi, how are you?
Excellent, good. I'm glad to see that there's some positive energy in here. I also want to appreciate everyone for bearing with us. We were told that there would be some kind of ability to use PowerPoint, and there wasn't. So we do, I'm always very transparent in my presenting style. We do have a PowerPoint that we are following, so at any point you see us kind of checking out this screen, it's just we're doing the best to make sure that we're staying on track for all of you. My name is Aiden J. Kaplan. I'm a licensed master social worker, and I currently serve as the LGBTQ Youth Services Manager at Pride for Youth, which is located in Belmore. We are going to talk a little bit about our agency. Basically what that kind of title means, very simply, is that I wear a lot of hats at the agency. I oversee all of our administrative aspects of our youth-specific programming. We're Pride for Youth, that's a lot of what we do. I also oversee our social media and marketing, our internship program, a lot of kind of different pieces of the program, as well as supervising some of our staff. So I'm going to turn it over to Charlie to introduce herself.
My name is Charlie Arrowwood. I am the Community Mobilization Manager at Pride for Youth. So I do a lot of HIV community outreach, and I'm on the Ending the Epidemic Committee for Nassau and Suffolk. And I am also a licensed attorney. I'm the Director of Name and Gender Recognition at Transcend Legal, and I also do some family law work.
Excellent. So jumping in, before we kind of talk about our curriculum for today, we want to make sure that everyone has heard about our agency and a little bit about what we do, because we might be a resource to you. So to kind of start off, we are owned and operated by the Long Island Crisis Center. By show of hands, who's ever heard of LICC before? All of you, excellent. Most of you were probably in a presentation about like a half hour ago with LICC, which makes my job a lot easier. Basically, LICC is a crisis intervention hotline, 24/7 hotline. We know that when you hear that word crisis, you often think of something that's like really big and scary. We consider a crisis anytime your regular coping skills just aren't working for you. That's a great time to call our hotline. So it doesn't need to be something really big and scary. It can be anything you're going through in life that you just feel like you could use a little bit of support for. Great reason to give us a call. Now, in the early 1990s, LICC got a lot of phone calls from people who identified as lesbian, gay, bisexual, transgender, or queer, although in that time period, some of the terminology was a little bit different than we use today. But they were getting a lot of phone calls on that hotline from people who had no support anywhere that they could go on Long Island. And as a referral database, being LICC, we had nowhere that we could send these people, and we don't like hearing that. So instead, we created our own agency. In 1993, they opened Pride for Youth to fill that gap in services. So a lot of what we do is counseling, social programming, HIV testing, specifically for those who identify as LGBTQ. We were the first suburban LGBT center in the country, so we've been around for quite a while. We serve every year over 1,500 young people amongst all of our programs, and our community education program, as well as our professional trainings, serve about 9,000 people every year. Thank you so much. So gauging the climate a little bit, we work specifically with those who are LGBTQ identified, but we want to make sure that you all realize how relevant a topic this is. So can you just raise your hand for me in this room if you know somebody personally who identifies as any of those letters, LGBTQ? Every one of your hands is up, right? This is a relevant topic for us to be discussing. But a lot of you work in school-based settings as well. Would that be correct? Awesome. So in your schools, how many people typically would you say are like in your entire student body in the school that you work with? Like in your whole student body of your school, how many students go to that school? 2,000. I'm not here lower than that. 1,300 somewhere. 450. Okay. I want you to think about that number. Okay, whatever number you just listed. We know that 10% of our population identifies as lesbian, gay, or bisexual. From a study that was done back in 2010, we know that that's probably not such a realistic number for a lot of reasons. It's a self-reported number. Back in 2010, people weren't as comfortable sharing their identities. That's a big component of this, but also recognizing that in 2010, things were very different back then. It may not have been safe to share our identities. Most of the recent studies, specifically in New York State, have actually shown that closer to like 30 or 40% of our population identifying this way. For today's purposes, we're going to use 10%, but I want to just point those things out. So think about that number again. It's my only math question all day, I promise. If 10% of our population identifies lesbian, gay, or bisexual, how many students in your school environment should be out and proud about their identities?
200.
I'm not going to say that you're right or not, because you all said a lot of different numbers, but think about that, right? There should be a lot of students. But how many people in this room can say that in your school environment you have 10 students that are out? About 15. About 20. Right? Like most of the time, when I'm in any type of school-based setting, people are like, maybe 10, sometimes it's 5, sometimes it's none. Most of the time, I'm never getting over 20, right? So there's something going on in our school-based environments that's making people feel unsafe to come out, which is a lot of work that we do when we come in and do these presentations, is pointing that out. I also want to point out that we know that 0.7% of our population identifies as either transgender, gender nonconforming, or non-binary. 0.7% sounds like a really small number. We get that. But there are millions of people that live in New York State alone, let alone the entire country. That's millions of people in our country identifying this way. So this isn't a small population, even though that 0.7% number can really kind of seem like it's a small number. Jumping into some statistics, typically these would be up on the board behind me, so bear with me. There's a study that's done every like 2 or 3 years by GLSEN, which is the Gay Lesbian Student Education Network, right?
That sounds right.
Sounds right, okay. This survey is called the School Climate Surveys. They send this survey to schools all across the United States and ask them questions about their experiences as LGBTQ students in those spaces. And what the study showed back in 2015 is that due to their sexual orientation, 65% of students reported that they felt unsafe at school, 41% were physically harassed in school, 19% were physically assaulted in school, 32% skipped a school day in the last month because they felt unsafe, and LGBTQ students, or sorry, lesbian, gay, bisexual students were 3 times more likely to drop out of school altogether. Oh, thank you. Same study, but with regards to gender identity, 44% of students reported they felt unsafe. 55% experienced verbal harassment, that's more than half the population. 49% experienced cyberbullying. 32% skipped a school day in the last month because they felt unsafe. And again, they were 3 times more likely to drop out of school. 61% of students stated that they did not report what was going on in their school-based environment because they felt that staff would not intervene. And then 37% who actually did report it saw no action taken. Does everyone in the room know what DASA is? The Dignity for All Students Act. We know that there is specific language in DASA that protects people on the basis of sexual orientation and gender identity. It's one of the first policies in New York State to ever include gender identity, especially when it comes to a school-based setting. So recognizing that even though schools are supposed to have a DASA coordinator in every school, a lot of the schools that I work with have one per district. Recognizing that if this person isn't in your building, how can students identify that person? Now, I'm happy to report that I worked really closely with Legislator Lapizan last year to write the anti-bullying bill that passed in Nassau County. What we were able to do was include specific language for the LGBTQ community and protecting things on the basis of sexual orientation and gender identity. But what this did was it created nassau.stopbullying.gov. And this website is a place where individuals can go and actually find out who your DASA coordinator is and their contact information. And because it's signed into law, every school every year must update that information and make it accessible. Before this year, we didn't have that. It launched this past September. We also know that LGBTQ youth make up 40% of the homeless youth population. Remember I said that they make up 10% of the general population. They make up 40% of the homeless youth population. It's a really disproportionate number. And LGBTQ youth are at a 4 times greater risk of suicide attempts. Charlotte.
So I want to talk a little bit about the difference between gender identity and sexual orientation. Does everyone think they have a good idea of the difference between those two things? So sexual orientation is who you want to wake up with. Gender identity is who you want to wake up as. So sexual orientation has to do with your interpersonal relationships, your romantic and sexual attraction. Your gender identity has to do with who you feel like inside, how you want to project yourself and how you see yourself and how you want other people to see you. So there are things like your gender expression, which is, you know, the way I look. I think most people would say I look like relatively masculine. They would peg me as male. I actually am not male, but we'll talk about that in a little while. But that's your gender expression is different from your gender identity. Your sexual orientation is different than your gender identity. And for sexual orientation, that typically develops around the ages of 8 to 10 years old. So you'll remember if you had like your first crush, you remember how that felt. And so for lesbian or gay or bisexual kids, that felt the same. It was just directed in a different direction. So for straight kids, those things are celebrated by their family, they're supported, they are acknowledged as, you know, milestones. And, you know, even I have a 3 and 4 year old at home, and when they were born, everyone got them all the shirts. Like my son got like Chick Magnet. He was like in a onesie. Like, you're making a lot of assumptions here. And it's culturally supported and celebrated in community and media. For LGBTQ youth, that's not really as common. We get a lot of calls, especially, I guess you probably deal with a lot of counseling clients and stuff, and the parents call and they say, you know, my son might be gay, my daughter might be gay. What do I do if they come home with someone of the same sex? And my answer is always, what would you do if they came home with someone of another sex at their age? You just plug in, the same response and just treat it, affirm your kid, make sure that they're comfortable and safe. But because of the education that a lot of people are doing, young people are coming out earlier, both regarding their sexual orientation and their gender identity. Gender identity is actually solidified much younger. So whereas sexual orientation is more around 8 to 10, gender identity is pretty solid by around 3. So, a 3-year-old is going to have an idea of, I feel like a boy, I feel like a girl, something doesn't fit right. There are a lot of gendered things about childhood and about our society. So the color of clothing, the type of toys, the type of activities that children engage in. And we try to categorize people based exclusively on genitalia when really gender is made up of a lot of different components. So there's, your chromosomes, your hormones, primary sex characteristics, secondary sex characteristics, your brain sex. It's a whole combination of things that is more than just biology. And so when when a baby is born and you determine based on their genitalia that you think they're this or that, there's a potential to make a mistake. And so sometimes people have to correct it. Okay, this is me. So as far as transition, there are different components to transition, and it can be medical, social, legal. Trans people, some go through everything, some go through, they pick or choose what works for them. And as far as legal transition, a big part of that is the name and gender marker change and identity documents. And that's what I do at Transcend Legal. I help people change their name, I help people change their documents. And right now, the cool new thing is to allow for X gender markers on government documents. So that's been happening across the world in a variety of countries for some time. In November 2013, Germany allowed for it. The international agency that governs passports allows an X on a passport. So if a country has X's, we may feel funny about it here with our passports, but it is allowed. You can travel internationally with that. But because the federal government is not supportive of that, we find states are doing it on their own. So things like driver's licenses, birth certificates. Now states are coming up with ways to change their infrastructure and their technology so that people can actually get the gender marker that fits for them. Some states are more difficult than others to change their gender marker at all, but in the states that are kind of making it easier, they're adding the X along with making the process for changing everything easier. So you can either be in a situation where you need a court order or you need a doctor's letter. And now a lot of states are allowing you to actually just sign an affidavit saying, this is who I am, change my gender marker. In New York City, effective January 1st of this coming year, people with a New York City birth certificate will be able to sign that affidavit instead of needing a doctor's letter, and they can choose an X on their birth certificate, which is what I will be doing, and I'm very excited about it. Nobody has any idea what's going to happen when you bring that birth certificate to somewhere that doesn't take an X. No one knows if they're going to make you pick one. They don't know if they're going to leave it blank, if they're going to just start putting X's places. So that's going to be an experiment, and there are like 5 states: Washington, D.C., Washington State, Oregon, California. Arkansas allows an X. They were doing it for years and nobody realized. Yeah, I don't know. And hopefully in this coming year, New York will also allow it. I will say, for those of you who work with students, which is all of you, in New York State, if you have a New York State birth certificate, you're not able to change the gender marker on that until you're 18. So you would change it on your passport in lieu of the birth certificate and use that as your identity document. But that's something that I'm personally working on changing with some legislators at the governor's office. And so hopefully, in addition to allowing the X and making it easier to change everything, young people will also be allowed to change their documents because it impacts every aspect of their life. When they're at school, a lot of schools want to see, yeah.
So I just want to be clear, are you saying it's in the works in New York State that people will be able to use the X? I mean, that's some legislation.
Nothing has been passed yet, but so the DMV is currently actively figuring out how they're going to implement the policy because people from New York City are going to be coming to them with birth certificates starting in 2 weeks. So they are ahead of the rest of the state a little bit because New York State and New York City issue separate birth certificates. So just because you live in New York State, like, doesn't mean that New York State issued your birth certificate. And so you can have students out here that were born in New York City, and if they have an X, what is your school going to do about it? So the DMV is kind of ahead of everyone else, but as far as other state agencies, New York State birth certificates, nothing has passed yet. We're drafting legislation, we're drafting regulations that we want them to adopt, and we have a lot of friendly folks who are interested in pursuing that. So we're hoping in the next year something happens.
Hopefully.
Just really quick question, this
Yes.
might be obvious. When you say like the X, are you referring to like being non-binary?
Yeah, so,
Okay.
so a little bit of vocabulary before we go any further. There's transgender women, which are women who were assigned male at birth. Transgender men are men who were assigned female at birth. Non-binary people, whatever they were assigned at birth, don't feel squarely male or female. They can either be somewhere in the middle, they can feel like they don't really have a gender. So that's where the X comes in. So folks who don't want to be identified as either male or female. And that is how I identify. I use gender neutral pronouns, I use they, them. You may have some students that are also, that also use those. It's kind of a lot of young people are identifying as somewhere on that spectrum and not male or female, yeah.
And that's for birth certificates or driver's license?
So,
Because I'm asking that because I'm interested in what age can somebody, like you're saying, an 8-year-old may know that they want
Yeah.
to be identified as male. Could that parent change their birth certificate, or do they have to be a certain age?
on a New York City birth certificate, it can't be the original designation, but if the kid is 3 years old and said, I don't feel like a boy or a girl, it could be changed. They haven't come out with an exact, like, when they'll allow it. But I would imagine that someone is gonna decide they want to raise a gender neutral child and get their original birth certificate, and 2 weeks later say change it to an X.
I'm surprised that doesn't happen yet.
The thing is, because there was no policy about it before it, a few people got through the cracks and managed to do in New York City, but there was no like formal policy. Technically, because it has to be an affidavit from the person who wants to change it, a toddler or like, an infant is not gonna be like, I am affirming that I don't identify as male or female. An 8-year-old totally could. Yeah, so I think it's gonna be kind of trial and error to see how early they allow that. But the driver's license, I would imagine once the X is in place, you can get it as your initial marker, or you can change it if you.
Moving into some challenges faced specifically by LGBTQ youth, we refer to this community as the invisible minority. The reason for that is that a lot of the prejudice that other groups experience, we know that they experience it often because of their appearance. However, when we're talking about lesbian, gay, bisexual, transgender, and queer people, often the prejudice that they experience is based instead on behaviors as well as stereotypes, and not exactly based on their appearance. The other difference is that there is a lack of social support. So what that means is, if I, as a young Jewish person, go out into society and experience prejudice because of my religion, is it pretty likely when I go home at night there's somebody in my household who understands that kind of prejudice? It's pretty likely, right? But as a transgender person, if I go out into society and experience prejudice because of my gender identity or my gender expression, it's probably not as likely when I go home at night, I've got somebody in my household who knows that kind of prejudice, right? Or who can even turn to me and kind of say, like, I've been through this too, and it's gonna be okay, right? So there's a big difference when it comes to the community and feelings of social support. We also know that the community itself faces higher risk factors for maladaptive behaviors. So the first one we always talk about is suicide. We know specifically for those who are transgender, gender nonconforming, and non-binary, 42% of that population has attempted suicide by the age of 25. That's almost half of the population attempting suicide by the age of 25. We also know that in the United States, the average age of a suicide attempt in someone's life is just under the age of 50. So numbers here are really not lying for this community. It has to do a lot with lack of social support that we're seeing for this population. When talking about running away and homelessness, in our community, we often use the term throwaway. I don't know if anyone's ever heard that term before. So we're talking about running away. That's when a kid realizes I'm not supported and chooses to leave. When it comes to being thrown away, it's when your parents realize they're not going to support you and they ask you to leave. These are really big differences. We see huge percentages of both runaway statistics as well as throwaway statistics, which lead to a very high percentage of homelessness, specifically for those who identify as LGBTQ. When it comes to dropping out of school, I talked about earlier all those different things that are self-reported by the students that we work with, right? Feelings of being, having cyberbullying, physical assault, feeling like you just don't want to go to school that day and skipping school because you feel unsafe. All of that adds up to a kid feeling like either I don't feel safe in school so I don't want to go anymore, or I've missed so much school, I'm now so far behind, I don't want to continue to feel this way. And often the students drop out for that purpose. We need to recognize that most straight students are a very small portion of straight students are dropping out of high school. But when it comes to the LGBTQ population, we're seeing much higher rates of that. And that means that kids are having a much different experience than their straight counterparts or their straight peers. And they're having less access to education, less access to opportunities in their life because they're not attending that school environment, and less access to socialization as well. When it comes to drug and alcohol use, usually I'm used to having it up here, so it's hard to follow on a laptop. When it comes to drug and alcohol use, can anyone in this room guess which part of the LGBTQ community has the highest rates of alcohol use? Anyone want to give a guess?
Trans.
No, that's usually what I hear, so it's a really good guess. Who do you think? Are lesbians? No?
Bisexual?
Gay men. Gay men. So let's talk about that. Before I actually share with you, does anyone want to guess why that might be?
I
think because of the cultural image of a man being tough and being very masculine, being protective, being unemotional, etc. The image of him.
I'll take it. Not exactly what I'm looking for, but I'll tell you, it's a really good point.
I'm just thinking about the kids at my school, and I see like a lot more girls feel comfortable coming out as bi or lesbian, and they don't get as bothered as much. It's more accepted and it's cool. Whereas like if the guys, they will get teased and bullied till forever.
Okay, I'll take it. Any other ideas?
There's a big cultural piece to it in terms of socializing and, sexual interactions and whatnot.
So where is the number one place where young gay men meet their partners? Whether it's sexual partners or bars. Gay bars, right? Recognizing that for most of you, while you might have seen a gay bar that had a lesbian night, most of you in your lifetimes have never seen a lesbian bar. They exist, but they're very rare. None of you in your lifetimes have ever seen a transgender bar. I don't think they even exist in our society. But recognizing that there is a component to the socialization as well as the kind of romantic and sexual interactions in the gay community that often happen in these spaces. The other thing is historically, gay bars were the only safe place for gay men to be. So if you felt safe there and you were more likely to be able to meet people like you, you were more likely to spend a lot of time there. And if you're spending a lot of the time there, you're more likely to participate in the activities being offered in that space. When it comes to HIV and STD contraction, we usually learn about HIV as the gay men's disease. But we need to recognize that it has nothing to do with being gay. It instead has to do with participation in anal sex. So we know that anal sex is the highest, has the highest chance of HIV transmission of any sexual act that exists. And it simply has to do with the fact that the anus is not self-lubricated, which means it's more likely to have tearing in the anus that leads to the spread of HIV. When we're talking about anal sex in this promotion or in this transmission of HIV, we recognize that gay men are much more likely to participate in HIV simply because it's a way that they can have sex. So this isn't necessarily a gay man's disease, it's just simply easier spread through an interaction between two men who might be participating in sex. When it comes to higher rates of depression and anxiety, we see this in the community kind of across the board, but for those who are transgender, gender nonconforming, and non-binary, we see huge rates of anxiety and depression. We work a lot with parents. What I hear a lot in the work that I do is parents who come to me and they're like, I'm not even touching the trans issue until we talk about the anxiety and depression, right? As a therapist, they're always requesting that of me. And a lot of times what I have to get parents to see is it's the opposite. If you support your child, if you make them feel affirmed, if they don't feel challenged in their society and in their home, kids have lower rates of anxiety and depression. We've seen that across the board over many, many years of following this community and what's going on for them. So supporting a kid can be really helpful. Obviously, there's exceptions to every rule. In some cases, the anxiety and depression is so overwhelming that it can lead to risks when it comes to the transition, but in most cases, supporting the transition or supporting the identity can help to reduce the other two pieces. When it comes to lack of visibility on things like intake forms and the census, when it comes to intake forms, how many of you in your lifetimes, when going to a doctor's office, have been asked if you were anything other than male or female? Not a lot of you, right? Very few of you. So how might that feel if you walk into a room, or if you walk into a doctor's office, there's a form in front of you that has two options, and your identity isn't represented there? It's wrong for a lot of reasons. It's wrong because you look at it and you know that you're not represented, you know that you're not respected for that reason, but also recognizing that we're not properly keeping track of your identity, which means for research purposes, we're not following this community, and that's a big issue. When we talk about the census, we know that in 2020, the first time ever, we were supposed to have the LGBTQ community represented on the census. You all probably know that's not going to happen this year. That's been pulled away. I'm not going to talk about politics, but I do think it's important to represent that when we're not asking questions about your identities on national documents like this, we're not keeping track of this community, then it's difficult. Like when I come in and do these presentations and I say 10% of our population identifies this way, or 0.7%, we can't update those numbers and show you the community exists if we're not keeping track of this population. And it's also really not affirming as a person who lives in the United States to not have your identity represented when every other type of demographic is being asked about. Any question?
No, I just want to make a comment. I just think that a lot of that politically, and I'm not going to get into politics either, but has to do more or less with if we sweep this statistic away, then we sweep away the power of that demographic to make change.
Absolutely. Thank you for sharing that. It's really important. And when we're talking about things like lack of equal rights, in New York State, we do not have any protections for transgender people when it comes to employment or housing discrimination. We have attempted for the last 17 years to pass GENDA, which is the Gender Expression Non-Discrimination Act. For 17 years it's come up, for 17 years it has not passed, but recognizing that a lot of the work, especially that Charlie and I do, is politically kind of challenging to make sure that we are showing our legislators that this community exists, that their rights matter. But what I've kind of found is it's not always about fighting on the state level. It's going to take a very long time until we get rights on the state level. But if we can fight locally, we can create change here. So Nassau County also doesn't have protections. So as people who identify somewhere in the trans kind of umbrella, probably not at our job because it's an LGBT agency, but if we worked anywhere else, and I used to work at Starbucks, I could go to work tomorrow, tell my boss that I was trans, and be fired because of that identity. And New York State have very little ability to challenge that. When it comes to Nassau County, we're trying really hard to get those protections here. Some counties have gone ahead and created protections, but most have not. So there are, even though we believe that we've gone a really long way, especially with like marriage equality, we have a lot further to go. Challenges continued. So LGBTQ youth face disparities in the following areas. Positive adult role models. Again, a lot of the work that we're doing is not just participating in the programs that we run, but also being able to model positive behaviors for our youth and show our youth that we work with that there are possibilities for them, not just possibilities of being out and being proud about our identities, but having access to like healthy relationships that we have, having access to degrees and employment at some point in their life, and being able to create a future for themselves. A lot of the youth that I work with tell me that they never believed that they would live past the age of 20. As a transgender person myself, I get that. I didn't think that I would either. And now here I am turning 26 in 2 weeks, and I look back and I remember those feelings of thinking that I wouldn't be able to do that. We have an ability to turn to the youth that we work with and show them that they don't have to feel that way either. We understand why they feel that way, but continue to remind them there are possibilities for them. We also, as we brought up yesterday in the training, we have the ability to do it for parents as well. So a lot of parents have kind of look at us and say things like, see, it's possible, to their kids.
While their kid is sitting right there.
Yeah, like, see, it's possible, you could be like this, you could be successful, whatever words they throw at us. We have an ability to kind of change the way parents view their kids' future as well. When it comes to sexual health education in mainstream settings, I can pretty much guarantee that no one in this room learned about the LGBTQ community in health class unless it was in reference to HIV or STIs. Right? We're all pretty much in agreement. We don't learn about the fact that in the LGBTQ population, we should be talking about this population for every single health topic we learn about. We know that lesbian women have a higher risk of breast cancer than any other population. We know this because lesbian women have a higher rate of stress than any other woman within our society, especially when there's intersectionality of identities. So understanding that focusing on stress levels can increase your risk in general. When we're all stressed, we all feel run down, we're all likely to get sick in general. When it comes to disease later in life, those things are issues as well. So if we're not studying, we're not talking about all these things in a more widespread area, we miss an opportunity to really learn about this community. But not just in health classes, in your history classes. How many of you learned about LGBTQ culture or history? But you learned about a lot of other populations, right? So recognizing that we can mainstream all of these topics and not just talk about them when we're talking about HIV and sexual health. When it comes to, just making sure I'm on track, opportunities for socialization and safe meeting spaces. This is where Pride for Youth really shines. That's what we are. We offer socialization opportunities, safe meeting spaces. We talked about like dating in bars earlier, right? Recognizing that for a lot of the youth that we work with, they go and meet someone on Grindr. Everyone knows what Grindr is?
Yeah,
Awesome, most of you. When we talk about Grindr, a lot of my youth meet someone on Grindr and they go to a bar and meet this person, which is a very unsafe way to do that, right? We promote to all of our kids, go meet that person. We want you to have those connections, but meet that person at Pride for You. Meet that person with staff around in a well-lit area, right? We can provide that safety in a way that a lot of other spaces can't. When it comes to awareness of other LGBTQ affirming resources, one of the biggest ones that comes up is like churches and religious spaces. They exist on Long Island, affirming LGBTQ religious spaces exist on Long Island, but so many people do not know that they exist or don't know how to locate them. So a lot of what we do is make sure that we're talking about those spaces and making sure our kids have access to them. We also have great relationships with like Transcend Legal, which is also where Charlie works, to make sure that our youth have connections to resources that are important to their identities. For a lot of the kids we're working with who are transgender, gender non-conforming, or non-binary, name and gender marker changes are really important to them being themselves and being authentically seen that way, especially by our government. Having close relationships with agencies that provide that service really strengthen our agency as well.
Just wanted to know about resources for younger kids. I'm running into a larger population of self-identifiers who are much, much younger, who are now, at the 10 to 13 age group. And there's no real socialization opportunities for them. And they're looking for the role models, they're looking for all those things. And I mean, Pride for Youth is something that I espouse highly, and I really thank you for the work that you do. But it's just a matter of what do we do in these little communities where these kids are that there may be two in the entire community that are identifying this way. They're best friends, but they're getting killed in the lunchroom.
So some of this, and I'm a big proponent of this, and my agency hates when I say it, but I'm going to say it anyway, hold your local agencies accountable. So years ago, Pride for Youth had a program that we called Stepping Stones. And it was for kids, I believe, between the ages of like 7 and 12, who identified somewhere as LGBTQ, and it was like a once a week or once every other week, I was around when it existed, space where kids could really just come and play and interact and watch movies, and like have a safe space. And over the course of a couple of years, we realized that kids weren't really engaging in it anymore. We closed the program. But to be honest with you, it's still written in our rules. So I always talk about like we're seeing a change now. Kids are coming out earlier, kids need the support. Why aren't we talking about bringing these things back? And unless we're pushed by the community, we may not make that step. What I will say is there is an agency called TRCLI, which is the Transgender Resource Center of Long Island. They do have a youth support space that is, I believe, from like ages like 5 and up, something like that. I'm not 100% sure. You can go to trcli.org to get more information. I don't work there. But they do have a space that offers this. But I always try to point out that in agencies like Pride for Youth, you are going to get people who have some type of educational background in mental health. When it comes to TRCLI right now, I believe that everyone that's working there is a member of the community, but is providing the service based on their experience as a community member. It may not be working like with a social worker. I know a lot of people really do want to have that mental health provider there, so just kind of throwing out that as well. But we do need more of these resources. We're really lacking right now.
I would also say a lot of times public libraries will have programs for younger folks, or a JCC community center kind of thing. They may have groups running and going on, so it's just a matter of even if they don't, that's somewhere that you could send those families to say, let's start something up, and, you know, if it doesn't exist, you can make it.
I work for the Board of Ed in the city. I'm a social worker from the Division of Early Childhood. And our division is training us, the social workers, to work with young children, ages 3 to 5. So I think that's pretty awesome. I'd love to see it spread throughout the district, yeah.
I will also just kind of add to that, the presentation we're doing today is a much smaller version of what we usually do. We go much more in depth. We talk about really serving this community. We can't do that at a conference when we're only given like 45 minutes to an hour. So if you're ever interested in bringing in our agency to do a more in-depth service for whatever services you're providing, whether it be a school or an agency, please reach out. We're always happy to either come in and do the training or have conversations about the trainings that you're doing and ways that you might be able to improve and do both of those. So just kind of point that out as well. If we can be involved in the dialogue, we love being involved in that stuff.
Another population that I think also is struggling with bullying, you know, things like that. And I think, I'm not in the school district, but I can tell you with my own kids, I've noticed this, are children with same-sex parents who haven't yet identified or, you know, anything, but you know, are different because their parents are of the same sex. I work in a children's hospital at Cohen's, and we talk a lot about this because a lot of the forms in the offices say father's name, mother's name, right? So we're trying to sort of be more, you know, inclusive of everybody. But that's another population that I'm interested in hearing what you have to offer.
So when I got married, it was before I changed my name, and when my kids were born, it was before I changed my name. So my old name is on their birth certificates and my marriage license. And we're about to have to register my kids for school, so it's gonna look like they have same-sex parents, which, fine, but there's no way in New York State to change that document, to change my name on their birth certificate, unless I get a court order that says the Department of Health needs to change the name on the birth certificate. The court says that's an administrative issue, we're not gonna touch it. And so I'm gonna have to register my kids with the wrong birth certificate, but aside from that, then they're open to a double stigma situation where, I mean, because of my job, everybody in the community knows I'm out anyway, but, you know, the administration then knows that we're a different family. My daughter just had her tonsils out at Cohen's, and everyone was lovely.
I hope so. Yeah,
But the paperwork, you know, it's mother, father, and like, I don't call myself a father. So like, I always cross it out and just write like parent. Which I do, you know, on school registration forms, all of that. But yeah, it's you know, every registration form, intake form, all of that, it pegs your family as different. And, you know, luckily my kids haven't really had a huge issue. They're in nursery school right now though. So they're about to enter into public school, and I have no idea what's gonna happen. I know there are other families in the community, but yeah, it's exhausting. It's like, you guys know what microaggressions are?
Yes.
It's exhausting.
To just add to that though, our agency actually just participated in collaboration with the LGBT Network, which is in Bayshore, some of you might know them, Stony Brook University, and Hofstra's public health program, and created the first ever All Island LGBTQ specific, and it's really translating LGBTQ specific medical training for facilities. We, for the first time ever, gave that training last week. I did it myself. We're still learning it, so bear with us. But it's really, really good. I'll be honest, I wasn't part of the building of it, but it really covers a lot of things. In fact, we go over like 3 slides on ways that you can change your documents and ways that you can do parent 1 and parent 2 instead of mother and father.
We've gotten social work referrals, like, and what's the reason for referrals being their parent? Like, what? Like, that's just, and we've come a long way. I mean, this is not recent, but, you know, it's important for people to be educated because a lot of healthcare professionals don't, and a lot of healthcare professionals don't come from this area. They
Right.
train elsewhere, and they come here. So, you know, not to say that we're wonderful in New York, but I think we are a little bit more progressive than other states and other countries, so.
We try.
Well, and so much of it is like, you don't know what you don't know, so you don't realize that you have no, like, people make assumptions. So because a majority of the population has a mother and a father, you know, or even if it's just a single parent, you go into a doctor's office and you know, everything's like, oh, are you the father? Are you the mother or the father? Like, and it's, I don't know.
I just wanted to bring up one other part of the population of people that have to deal with this, but I don't think anybody really sees too much, and that's people with disabilities.
Yes, yes.
People with disabilities, I work with people with disabilities every day. Many self-identify as LGBTQ, but there's no resources. And this is something that's a real concern to me, particularly, and I don't mean to be just specific, but the deaf population. There's absolutely zero resource, except for the Episcopal Church of St. John Divine in New York City, that I can utilize to help these people to find socialization, others, so that they can feel that they're valued members of the community. And as I can tell you as a counselor, that it's astronomical the amount of time spent trying to help people pass the desperation stage. I'm sure you've done.
So we actually on Long Island were, until about 3 months ago, the only place to go if you were LGBTQ and deaf, because our executive director was fluent in sign language and was a gay person and was able to, if there was a need, he couldn't commit to going to every group for the person, but he would be willing to commit to like at least going once a month for the person if someone really needed it. It's not a perfect version of the resource, but it's a better one than a lot of the ones we've got out there. What I will be honest about is our executive director left the agency in August. So with that in mind, or executive director of Pride for Youth, not Alexis, but Pride for Youth. So with that in mind, we have recognized that there is a lacking there. I have advocated for the very basic, can our staff go to a training and learn at least how to communicate with someone on a very basic level to make sure that we can give them referrals and access to services, even if we can't write counseling and sign language, something. So we have talked about it. Our main issue right now is because we're going through restructuring, very left, we're all like kind of really spread thin. There's no time for trainings right now, and we have talked about it because it's necessary. I would love to say that we should really be hiring the staff. At least one member of our staff should be fluent in sign language. We're just not there yet. So hopefully we will get there. It is on our minds.
Just in the same vein, are you aware of any resources for the neurodivergent community? So I work with a lot of students who are on the spectrum, and a lot of them are also self-identifying, and where do I send you? I don't know.
I was just gonna say, so Transaction, which is the trans support space that I facilitate on Tuesday nights, I figured there's 2 questions in this book. We've kind of gone diverged off of it. So Transaction started off without this intention, for no negative reason, just it was a worker for trans people. And what we found was last year, 70% of the transgender people that we served were somewhere on the spectrum. And we are seeing overlapping by like a huge number, transgender people, gender people, non-binary people, who are overlapping with the fact that they're somewhere on the spectrum. So while the group isn't specifically designed for this, we did recognize that this was a need that we had, so the staff that work this program have gone through specific trainings to make sure that we are meeting both needs. Again, it's not the priority of the group, but we are able to meet needs. However, what I will say is if somebody is on the spectrum and they're I'm trying to think how I would say this. And would not be able to participate in a mainstream group setting and conversation, that sometimes does get in the way, so we may say that somebody's not appropriate, but I would say in the 3 years that I've been running that program, I think we've said that's 2 clients out of the hundreds and hundreds that we've served that have been on the spectrum. So we are definitely open to working with the community, but there are sometimes some limitations, especially in a group-based setting versus individual counseling. It's totally open, but group-based setting gets a nice limitations.
I work in a high school and I work with a lot of trans students, and I'm kind of the liaison between the students and the staff, and the staff is perplexed because everybody's very locked into legalities of pronouns.
I was waiting for this.
And some of the trans kids are out and some are not, and the ones that are writing their chosen name on their papers, and the teachers are very confused, and they're looking at the records, and the records are, specifically I'm thinking of, these are females on the records with feminine names, and now they're identifying as male with male names. And now the teachers are very confused and nervous about how they do address them informally and formally. So, I'm trying to coach the kids to identify yourself by the name you want to be called and the pronouns that you want used. And they're like a little about that. And then the teachers, when I try to explain to the teachers, this is so-and-so, and goes by the pronouns he and him, and the teachers freak out. Because not so much that they're against it or they can't handle it, they don't want to do something that's not legal. especially the kids that are not out to their parents.
Did you mention that you were a social worker, as you said?
Yeah.
Social worker, excellent. So how many people in the room are social workers or mental health providers? Awesome. So I want to just point out, anyone who's seen me do a training before, I'm a social worker, I stress this a lot. I just want to congratulate you and celebrate you the fact that you followed the guidance of your client. I do want Charlie to respond to the legalities of this, but I'm a big supporter of the fact that the NASW about 2 years ago, almost 2 years ago, came forward and made it very clear that your code of ethics says that you must follow the name and pronouns that a client shares with you. So if you are a social worker in the room and you are refusing to use the name and pronouns the client says they want to use, whether it's legal or not, you are going into code of ethics and could lose your license. So as a social worker myself, we need good social workers. Please care about this community. Please respect their names, and pronouns. And if you don't, we will come after you. I'm kidding a little.
So as far as legality, the only time that a legal name needs to be anywhere is on a diploma, where you can also have like an AKA, or like an official transcript, because that is a state-issued document, that's a state-maintained document, so that needs to have a legal name on it. Internally, at the school, there's no reason that that school should not have a little AKA or chosen name section in the records. Sometimes it takes a little bit of updating the software, but that legally, really, schools need to start doing that.
These are all minors, of course. Do they need parental permission to change the records?
They should not.
Okay.
If it's not like officially changing what's going to be on the diploma and all that, for that you would need a legal name change, which doesn't require parental permission. If you're under 18 and you want a legal name change, you can have anyone over 18 file on your behalf. You just need to notify your parents. So you need to give them
I
a
just want to
chance.
say that with social workers, you should not be that person.
Right, yeah, no, no. But, you know, if they have an older sibling or a family friend or something, aunt, uncle, grandparent, whatever, who is supportive while the parents are not, that person can file on their behalf. They're gonna have to notify the parents that they're doing this, and they're gonna have to show the court that they've notified, but that's just the little certified mail slip. They don't need parental permission necessarily. The standard for the name change is that it substantially advances the interests of the child. So that is a very easy standard to meet for a trans child who is trying to be supported and affirmed. Even judges who are kind of difficult understand that, you know, a parent stomping their feet and saying, I need you this, I don't want you to change it, is not compelling. So that is something to keep in mind. Like, there are mechanisms for children to take care of things that they need to take care of, even without supportive parents. I would also say that if a parent is unsupportive, AID runs a parents group for parents of trans children. It's phenomenal.
What is that?
I got you.
But as far as the legal stuff, like, really, the rule is that the school needs to respect them. They don't necessarily need to even notify the parents. What's the difference? You're just calling the kid a different name and using he instead of she, or she instead of he, or they, whatever. There's nothing official about that. So if teachers are concerned about that, they're more likely to get into trouble by not cooperating. Because if someone files a complaint, that's a protected situation. DASA exists, and other civil rights laws and human rights laws exist. They're more likely to get into trouble if they cause a problem.
Well, you were saying on the diploma, there's a right to have AKA, like literally on the diploma?
I don't know that it would say AKA, but it would have the legal name, and then underneath it you could put the other name. As long as the legal name is on there and the state can track that this person has graduated.
I think they tend to do parentheses.
Right,
Yeah. Right. You know if that applies to colleges too?
Colleges, I think, can do whatever they want.
Okay.
State schools, I don't know about. Private schools, I think, can do whatever they want. I actually, my law school diploma had my birth name on it, and after I changed my name, like 4 or 5 years after I graduated law school, I went back with my court order and I said, you know, I don't know if you can do this, but can you just change my records? And I said, yeah, you want a new diploma? And they sent me a new diploma. Yeah.
One of the things that worked really well for me in high school was I applied for a legal name change when I was 17 got denied. I was 2 months away from my 18th birthday, and the judge responded, "You need to wait till you're 18." Yeah, it's terrible.
Which judge?
I don't remember. I can find it. Charlie's gonna fight for me. But when I went through this process, I was really excited because I was like, now my diploma will say what I wanted to when I graduated high school, and then this happened, and we couldn't get it done in time. So I was really lucky to have an awesome guidance counselor at the time who printed both. She kept it in my file, so when I graduated, like what they mailed to me was my birth name, but the day I graduated, she brought me to her office, let me take a picture with my one that said the name I was changing it to, let me like show my mom, and we're all excited about it, put it back in her files, and said, the day that you get that name changed, come to me with that paper, and it's yours, like no problem. And they did, and that was so nice for me as a person who didn't have access to that, to be able to still celebrate the way I wanted to and have this thing that felt affirming for me, even if it wasn't something I could keep until it was kind of permanent and legal. But I always recommend that when I go to schools, like, if you really feel like you can't and you have to give one with the birth name, you can print one with the name that they're going to be choosing and keep that on file for when it's ready. And I think that means a lot to the kids that I work with. And some schools have chosen to do it. It makes a big difference.
One other thing I want to add really quickly, SATs and college applications. That's going to have whatever name is tied to their social security number. So if they haven't had a legal name change yet, and they're going in and registering for the SAT or sending off a college application, FAFSA application, any of that, that's going to be whatever their social says. So if it's possible, you want to get them, their name changed before they go through any of that process. It is possible once you've taken the SAT to get the College Board to change that. And it's not super complicated, but the easiest thing to do is if the kid knows what they want their name to be, do it before they apply for college, do it before they register for the SAT so that everything is lined up and they can apply to college.
To add on to that, I had a young man who started with one name and changed to another. How do you address that? I said, well,
Legally or just?
Well, legally. What if they decide to change the name altogether?
Well, so they legally changed their name from their birth name to name one and then decided to go.
Well, not yet, but
to
potentially that can happen, yes.
It's a court order, you just change it.
Okay.
Yeah, same process, yeah.
What about an IEP? You have to, can you put whatever name on that?
That I would imagine would be whatever's on the school record officially. But that doesn't mean that you can't have a line that says, call this person this.
Right.
Yeah, definitely, anywhere that you can put a little thing, parentheses, an alert, whatever it is, that you can make clear that whoever's looking at that screen knows not to. A lot of the problems that we run into or that I see are substitute teachers. If the school records aren't changed and they get a roster, they don't realize that they're supposed to refer to this kid differently. So that's where it's really important to have a little note.
For people who freak out about the name changes, because there are some, I try to affirm them by saying, what about if your name was Humidor? Humidor Everett Johnson, okay?
This doesn't fit.
You're not gonna be walking around letting people call you Humidor, okay? So you're not gonna freak out that they're calling you Everett, or they're calling your kid Everett after you name him Humidor. And I don't think you should care whether or not they're calling you Jeffrey or Jamie. It really doesn't matter, as long as they're happy and,
Yeah, and as far as like notifying the parents, like I said, you don't need to, I said already, you don't have to, unless the kid is ready for you to do that. And it might actually be the right place for a social worker or a school guidance counselor to be the one to sit down with the parents and the kid and say, this is something that's going on, and these are the ways that we can help kind of walk through this together.
I have a feeling we're probably out of time. I hear a lot of guys out there. I have no idea how much time we're giving. We have talk. What I do want to say though is, if anything comes up that you have further questions about, I'm digging right now to get a stack of my cards. Charlie's new at the agency, so they don't have cards yet, but I do. Please reach out to us, whether it's just like questions that we had today. If you want to just bounce them off either of us, I'm extension 16, they're extension 17. Reach out. If you have questions or you want to connect with services, feel free to reach out to our agency. We're also the staff director at prideforyouth.org. Both of us are on there. We'd love to be assisting you in any way we can. Thank you all so much.